This is Sherry Boschert reporting for Global Medical News Network.
It might make sense that the younger you are when you start using marijuana, there would be differences than if you start later on. At the American Society of Addiction Medicine, Dr. Yusuf Mahfoud reported on a study of just this. Dr. Mahfoud, why did you do this study?
We did this study because basically, as we all know, like marijuana use is very prevalent in adolescents. It's like the number one illicit substance used for this age, and unfortunately, there are a lack of studies done in that. Usually, adolescents are excluded from studies in substance use. So we found it's like kind of important to address the subject, especially that there's now like kind of a policy all over the country to try to legalize marijuana. So it was kind of important for us to see if it's really harmful or no.
So is this some of the first data on preteen use of marijuana?
Yes, it is, because like this is basically the study with the biggest number of kids less than 13 who've been using, who started to use marijuana before that age.
So what did you find when you looked at teenagers who were less than 13 years old versus older?
Yeah, so what we found that teenagers who started using marijuana before age 13, and those are not necessarily only marijuana dependent, those are kids with any substance dependence disorder, but they started their first use of marijuana before age 13. We found that they have like some worse outcomes. For example, they had more suicidal attempts, they have a higher rate of PTSD, they had also bigger number of substance dependent disorder. They had a higher rate of marijuana dependence, higher rate of hallucinogen dependence. They were also presented to treatment at a younger age. So these are like some of the worst outcomes that we found with those kids.